Good morning and welcome to Look and Feel Your Best with Dr. Patrick Flaherty. I'm Gina Birch, and we're going to be with you this morning for the next hour, giving you some great information on how you can look your best and in turn feel your best. Good morning, Dr. Flaherty. Good to see you as always.
Good morning, Gina. How are you this morning?
I'm doing pretty good. I've got a fresh cup of coffee in front of me, and I'm mostly wide awake and ready to go.
I'm going with non-caffeinated tea, which is good, but
great.
not quite as strong as what you got.
Mine's
going
loaded. I mean, not with sugar and cream, but anyway. So I know you all wanted to know our coffee and tea drinking habits here. Dr. Flaherty is the founder, the medical director of the Azul Cosmetic Surgery and Medical Spa offices in Fort Myers, Naples, and Bonita Springs, and he definitely is an expert when it comes to faces and turning back the hands of time. One of the things that I love about coming in here and doing this every week with Dr. Flaherty is the technology changes so much, and the innovations and the techniques, and it's just all, I always learn something new. And one of the cool things, we were talking about this, I don't know, a couple of weeks ago maybe, the Azul Instalift.
Yeah.
And you wanted to revisit that a little bit today and kind of give everybody an update, because the first time we talked about it, it was still kind of a new, everything old is new again. It was something that's old that was revamped and made new. So why don't you give us an overview of that?
I'd like to give everybody an update because, suture lifting, or what used to be called thread lifts, is what the Instalift is. And that was a popular technique a number of years ago, and we did a lot of them, and they worked well, and people liked them, and they were happy because it's a non-surgical facelift, and everybody's looking for that. That's the, kind of a buzzword. And the contour threads that we used a number of years ago were permanent, and they worked well, but sometimes people could feel them. There were a few things with them that were not perfect, and ultimately they end up being taken off the market, not because of severe problems, but I think the developer, who was a plastic surgeon, I think was concerned with some of the subtle things that, the palpability or whatnot, and worried about potential liability, I guess. So anyway, the new Silhouette Instalift is a new suture that solved really both of the problems that we had with contour threads. One is that it's an absorbable suture, so it's not permanent. So even though you might feel it when it's first put in, it's going to dissolve in about 6 months, or so. And it actually will stimulate collagen production because it's made of a polymer similar to Sculptra, which is really great. And two is it's self-anchoring, so you don't have to create knots. You don't have to suture it to the deeper tissue, and so there's no sutures involved at all, which is nice. You're just inserting this thread through tiny puncture wounds. And so why I wanted to revisit it, even though we just talked about it recently, was, I've done a lot of these in the last several weeks, and so I feel, I have, more information to share that I didn't have as much before because we were just sort of getting started, I think.
Right.
And so I thought an update would be good.
Okay. And this is kind of hard in a way. I mean, you to dumb it down and make it really compact into how it works, because this is such a complicated procedure, and how you insert the threads and put it into the tissue and lift it. And it seems almost too good to be true that I'm getting lifting and tightening in my face without having skin removal.
Right, yeah. And, it's easier to visualize than it is to kind of talk about,
Right.
You almost need the props to show kind of how the thread looks. But basically, and we, talked about this last time, you basically insert this thread under the skin. So you have to make a puncture wound, and you do that with just a little needle. And let's say we do that kind of on your cheekbone area. And typically, as with the other threads, I will use 2 threads to lift the cheek, 2 threads to lift the jowl, and then 2 threads to lift the neck. So you're using about 6 on each side, so 12 total for a full lift of the mid-face, jowl, and neck. And those have been working really well. So when you put these in, you make a single puncture wound in the center. If you think of a thread as like a suture, and let's say it's 10 centimeters long. So it's going to run, let's say, from your nasolabial fold down kind of by the mouth up until the hairline. And that's what you're going to try to do, is lift that cheek up. In the middle of that 10 centimeters, halfway up 5 centimeters is where you make the little puncture hole in the skin. And then the needles are these straight needles that the stitch is on a straight needle. It's called a bidirectional suture, which means the part of the suture that holds the tissue are cones, little cones that are on this, are actually attached to the suture. So you can imagine like a bell, a cone is like a bell. If you have cones, like let's say you have 4 cones on the suture and you're passing it through the tissue, if the narrow end of the cone is being pulled forward, then it slides pretty easily because the tissue just goes around the cone or around the bell. But if you then grab the other end and try to pull it back the other way, the open end of the cone, kind of the bottom of the bell, so to speak, would then have this big open area that would catch the tissue. Okay. So it passes very easily one way and it resists going the other way. So these are bidirectional. So when we put the super half in, so you go in at the cheek, let's say you pass that straight needle under the skin, and that's where it goes underneath the skin in the subcutaneous fat, and you pass it out up by the hairline, you pull that in. So that'll have these cones directed so that you can pull it up to the hairline easily, but you can't pull it back down to where you inserted it. So that's an anchor. That kind of serves as support or anchor for the lower half of the suture. And so then the lower half of the suture goes in the exact same hole, but instead of going up, it goes down, and that goes down and out kind of by the nasolabial fold. And in that case, again, the cones are faced so that they can slide easily down, but if you try to pull it back, it would resist. And so if you're pulling it back, you're actually pulling up the tissue. And so you can actually tighten the lower part of the face over those cones so that they're kind of attached or hanging. The cones are supporting it, and in that way lift the tissue. So you're lifting the lower face supported by the upper face, but without any knots. So it's very interesting.
And you see the results from this immediately. I mean, as you're doing it, the patient's awake and they can look and say, "Oh my gosh, look at that! Look at how that worked." Yeah,
it's great. So what we do is when the patient comes in, we do it right in the office. You don't need IV sedation or any of that. First thing we do is mark. So the marking is important because obviously all of our faces are different shapes and sizes. So we want to mark out exactly where I want to place each of the stitches, which would be the entry point in the middle, and then the exit point, the lower exit point, and the upper exit point. So there's 3 little marks on the skin for each sutures we'll use. So that takes a few minutes, about 5-10 minutes to do that. Then we use a little local anesthesia because we're going to numb. Now, you don't have to numb the whole cheek. All you have to really do is numb the entry and exit points, which is interesting. When you're passing this, it's a small needle and a relatively small suture. When it's being passed on the skin, even in an area that isn't numb, you don't feel it because there's not a lot of nerve endings in the fat. And so it's really, that's really cool because you don't need a lot of local anesthesia, entry and exit points. So we do that, and then we just do a little prepping of those areas, and then you just make use a needle to make the small puncture wound in the central point, and then delicately pass this needle under the skin in the subcutaneous plane until the exit point, and pass the other end out. One end goes down, one end goes up, and so we place all the stitches. So you'll do, the 6 on the one side, you go over to the other side, do the other 6, and once they're all in, it's kind of funny because you have all these little ends of the sutures like whiskers on a cat. We laugh about that. But then you'll fix the upper halves, which you do just with a massaging technique, which sort of locks them in, so to speak. And then on the lower half, you're going to hold the stitch and then massage the face up over the suture, over those little bells, and that helps to lift the tissue. So you do see the lift right away, and you kind of massage and lift up one side and then do the other side and then go back and forth a little bit and look at the face and kind of evaluate it. The degree of tightening, you're kind of getting sort of the maximum tightening and lift. Then you just cut the little stitches. The needles are removed when we place them. So as soon as they're placed, you take the needles off just for safety because those are, they're very, the needles look like a suture, but it's a long needle with a sharp point. So we want that off the table. So we take those off. Then you really just have the suture ends. Once we've tightened it, then you just trim the sutures right at the level of the skin. You just push down a little bit so it retracts underneath, and they just retract under the skin, and that's it, and you're done. And you can give the patient a mirror and show them the lifted face.
That's awesome. So I have this lifted face, I look better, and I'm like, a little bit of downtime, right? Is there a little bit of bruising or swelling? Because you just manipulated, a tissue on the face. So
Right. So what we're seeing seeing is that there is, a little bit of swelling, and there is a little bit of soreness. Now, when you first finish, people don't feel it because the areas are still numb. As the numbing wears off over a couple hours, people feel a little bit of soreness. Most of the patients we've been doing are taking either nothing, or they might take Tylenol or Aleve or Motrin, one of those over the counter. You don't need a narcotic or anything, but so there can be a little soreness. You can go home and use some gentle ice packs on the area to keep swelling down. One patient had a little bit of bruising on the cheek. Most people don't get any bruising, but you are passing a needle under the skin, so there is some risk of bruising. So a little gentle ice that night. Activity the next day. We don't want anybody doing heavy exercising for a few days, and we want them to be gentle with the face, which means, don't sleep on your face, don't do any aggressive rubbing or scrubbing of the face. If you can imagine, these little threads with the cones are, in the subcutaneous plane. It isn't a dissolvable suture, so you can visualize that the body's going to start to dissolve this. It's going to start to create collagen. There'll be this transformation. You want to kind of let that stay where it's at, without a lot of pressure or manipulation. So you want to be gentle with the face for first 3 or 4 days, and really, not do a lot of manipulation of the skin, so to speak. But the next day you can put makeup on. You can do most normal activities. We just have you be gentle with the face and no heavy exercising.
Right.
Yeah.
And then the other question that I think most people would have is, all right, so I know about my healing time basically, but how long does this whole thing last? And I know it varies from person to person, but generally speaking, what are we looking at?
Yeah, we're looking at a couple of years. I think it makes sense if, you get some tightening and then there's some fibrosis, which means new collagen is formed as a result of this suture dissolving. And the suture is made of a polylactic polymer, which is very similar to Sculptra. And we know how that works. That creates some dense collagen. So if you can get some collagen deposition that stabilizes the tissue, then I think 2 years sounds, like a reasonable interval of time for this to last. And, that's what we're looking at with this.
All right. So we're going to take a quick break here. And when we come back, we're going to do another update. I wish I had the sound effects here, but we're going to do an update on Coolsculpting and how you can get rid of fat forever.
We'll talk more about that as well, I guess.
You're listening to Look and Feel Your Best with Dr. Patrick Flaherty. I'm Gina Birch. We'll be right back. Welcome back to Look and Feel Your Best with Dr. Patrick Flaherty. I'm Gina Birch. So Dr. Flaherty's been updating us on the Azul Instalift. And I know I promised everybody we talk about getting rid of fat on this next segment. But, I was thinking during the break, we still have a couple more things we probably should hit if we're really giving the good update on the Instalift.
Right. Yeah, I do think there's a couple of things we want to talk about because, of course, it sounds great, sounds too good to be true. But like everything, there are strengths and weaknesses to any procedure and, certain limitations. So one of the obvious questions is, okay, who's a good candidate for this? And really, I think the best candidates are patients who have good skin and have a good amount of fat under the skin, that subcutaneous fat, because that's where the sutures are passed. And you want that robust layer of tissue because that's what's going to hold the face up and help it look natural too. And so, younger patients who, let's say, are getting early jowling or early laxity of the neck, who still have good skin and a good amount of fat, I think, we can get a nice lift with this. It's not replacing a surgical face and neck lift. So, it's more of a mild degree of improvement. But I think those are the patients that work well. Now, we've had patients who've had lifts who've come in who've noticed some laxity. And I think those are good candidates, too, again, if they have good skin and good amount of fat under the skin. Who wouldn't be a good candidate? I think patients with really severe sun damaged skin and really thin skin, our skin tends to thin with age. The fat disappears with age. If we're really thin with loss of volume, you think about it, if you're lifting the skin up, this is really a skin lift with stitches. You want to make sure that repositioning looks good. If it's going to look stretched or there's too many wrinkles in the skin for it to be smooth with that lift, then those wouldn't be good candidates for that. So it's not great for everybody, but it's good for the right patients.
Right.
Yeah.
So if you're looking in the mirror and you're kind of gaunt, you don't have a lot of that fat, and you're just have a lot of loose skin, then that would be the person. You would be the person than for a traditional facelift.
Yeah, and as we talked about before, three-dimensional rejuvenation, lifting, filling with maybe fat, fat augmentation, and tightening the skin with laser. Those are, really helpful procedures to help rejuvenate the skin, tighten and smooth the skin, fill in where the volume has been lost, and of course lift and tighten where the skin has gotten loose.
So where do those two things fit into the Azul Instalift? Because you were talking about the 3D and filling in those hollow spots and maybe resurfacing the skin. I mean, do you ever piggyback those with the Instalift?
Yeah, so you could. I think when you think about it, the Instalift is an office-based, non-surgical procedure. No sedation. So what are the other things we do in the office? I think it's good to pair it with fillers. Because you can add volume back with fillers. So if we're volumizing the face with fillers and getting some lift and filling, that can be helpful. So I think it pairs well with fillers. Laser resurfacing, of course, is, I consider it a surgical procedure. There's no stitching with that, but you are, removing a portion of the skin and tightening the skin, so the skin has to heal. So that's a little bit more downtime, so that would fall more under the surgical realm. But certainly you could do that. You could do a suture lift and laser resurfacing. That could be done. You probably wouldn't want to do it at the same time, just to avoid the heat energy to where you put the threads. But certainly the laser resurfacing can help rejuvenate the skin. So I think Instalift being a non-surgical lifting and a more mild degree of lifting, I think pairing it with fillers and Botox, for an office-based procedure is good. And I think it's going to be a nice addition to that, because we have a lot of patients who do Botox and fillers and have sort of maximized what they can achieve with that in skincare, and now we can add a procedure that can help lift the cheek, lift the jowl, lift the neck, and give them some tightening without surgery, without cutting and sutures, and that's a really nice addition. So I think it fits into that portfolio of procedures.
So you mentioned that the laser, the resurfacing and some of those treatments, the heat of them might affect the sutures initially. So is there anything else that might compromise that, in the first couple of weeks, say, or you do other things that you would have to be careful of?
I don't think so. We've had patients we've done fillers on and, really even a week later done the thread lift. I mean, the main thing is swelling. If you've had a procedure where you still have swelling, we want to kind of let that go down so we see exactly what it is. We don't want to be manipulating the tissue when it's swollen, because then it's a little less predictable. Right. But no, I mean, I don't. The thread lifts are. Relatively atraumatic, and you're just tightening and lifting the tissue. So I think, with fillers and things, it's, those things can be done, in short sequence together. Fillers 1 week and, the thread lift the next kind of thing. And
because you have these new synthetic threads, I know you kind of touched on this a little bit in the first segment, you're not going to, in most cases, you're not going to be able to see them and eventually not even feel them in your body, right?
Right. So in the very beginning, if you smile, you can feel them a little bit. I mean, not feel them, but kind of as you move your face. The little cones, sometimes there's a little popping sensation as it's, is moving through the tissue kind of. And sometimes people can feel like smiling. Sometimes they feel the end of the suture under the skin. We trim them a little bit beneath the skin for that reason, to try to avoid that. But the good news with these is, even if you do feel it a little bit, and most of the patients after a couple of weeks say they don't feel them at all, but they might feel like with smiling they can kind of feel it. There's a little bit of soreness, a little bit of tightness, and sometimes the suture ends where, down where the mouth is, where there's a lot of movement. You think when you smile, you move your face a lot.
Right.
So you're moving those stitches too, and sometimes you can feel that, but you can't see them at all, and then very quickly, because they start to soften, you won't feel them for very long. So that's nice, knowing that part goes away.
Right. So you said you've been doing a lot more since we've got this new technology with the threads and the dissolvable sutures. So are you doing mostly the face and the cheek? Are you doing the neck, or what are people coming in for to get the Instalift?
Yeah, you can do just the face or just the neck, but most of the time we do both, because most people are, have some laxity in both areas. And my feeling is, you have a certain number of interactions between these cones and your tissue. The more sutures you use, the stronger the lift is going to be. Obviously, if you just put one in, likelihood of getting a meaningful long-term result are probably not very good. If you're using 6 threads on each side, so there's multiple points of interaction, the force of gravity that's pulling the face down is being offset by a lot of these points of contact of these cones interacting with the tissue. So, I kind of think the more the better. And 6 would be 2 to the cheek, 2 to the jowl, and 2 to the neck. And we see when we do that, we get a really nice lift. I mean, it looks great right away. And so I think that gives you a lot of force to keep the face elevated for a longer period of time. So, again, we don't know the answer to how long it lasts. Obviously, like all of these things, it might be different from one person to the next, but short-term results look really nice. And I'm hopeful that as these sutures resolve over 6 months, that the collagen that's built will help maintain some shape and, lift and tightening to the face.
That's right. And besides the fact that this is non-surgical, well, there's so many great things. The people who are worried about scars and being able to see visibly that you've had something done, I mean, that's just not even something to consider right now.
Minimal concern. I mean, you are making puncture wounds, so like as we mentioned, you could have some swelling and a little bit of soreness for a week or so. You can have some dimples at the sites where you put the sutures in. That's a little bit technique dependent. We noticed a few in the beginning, less so now, but because you're passing these threads in, you can get a little bit of dimple. Those are temporary. They typically disappear over a couple weeks. Have you ever had a spot that didn't disappear, and quick enough within a couple of weeks? You could always inject a little saline or a little filler to fill that in and stretch it. So those little surface imperfections, we have a way to fix that if they were not to go away. But so far we've seen you might have a little bit of dimpling, most of which fades in a week, and pretty much all of it by 2 weeks is gone. So it's that's what makes it appealing. It's safe, it's effective, and it's no downtime. And if you were unlucky and got a little bruise, of course you could put makeup on the next day. Any of the little pleats or dimples or imperfections, we could fix with a little bit of filler. If somebody was really anxious and wanted to have it treated sooner rather than later, we could treat that. So we have ways to fix any of these small things, but they're small, and most of the patients haven't been bothered by them because they've faded pretty quick.
Now, you told us that we're talking here a little bit about the best candidate, and you've let us know that they've got to have a decent amount of good fat on their face, so these sutures hold, and they can't just have a lot of loose skin. Is there a certain age range where this kind of typically comes into play?
I wouldn't say age because
I know that's a tough one, right?
It is. I mean, we did a patient the other day. We've done patients in their 60s and 70s, which you would theoretically say, okay, 70s
that's
is
a facelift time,
too old, right?
Yeah.
But they've done well with this. So it's it really depends on the tissue. If their skin is in good condition, and it doesn't have to be perfect. I mean, you can have some sun damage, but the fat layer is probably the most important. If somebody was super thin, where it's skin over bone, that's probably not going to be a good candidate because you don't have enough tissue to place the threads in for it to look natural. But as long as they have a healthy layer of fat, I think you can get some lifting. And you can simulate it obviously in a mirror by just taking your fingers and lifting your cheeks and lifting the jowls and lifting the neck, and you can kind of see how does that look? And it looks good in most everybody, right?
Yeah, right.
A little bit of tightening works well. So like I said, it's safe, it's effective. The suture is going to go away. I think the risk of any kind of long-term problem with this is really low because you're really just placing it in the subcutaneous tissue. So I think because it is safe, effective, quick, easy to do in the office, I think it's going to be a popular procedure. People are very interested. Yeah.
So in this case, we need a little fat, but there are lots of cases where we look in the mirror and say, ooh, I got a little too much of that fat, and I want it to be gone. And that's what we're going to talk about next. I promise you, we're gonna get some updates on Coolsculpting when we come back. I know. All right, you're listening to Look and Feel Your Best with Dr. Patrick Flaherty. I'm Gina Birch. We'll be right back. Welcome Welcome back to Look and Feel Your Best with Dr. Patrick Flaherty. I'm Gina Birch. This morning we're doing some updates on some of the hottest, newest technology that's been going on here at the Azul Cosmetic Surgery and Medical Spas in Fort Myers, Naples, and Cape Coral. And last segment we were talking about the Instalift, which is a great way to have a facelift, but non-surgically. That's just a roundabout way of putting it, right?
Right. It is a non-surgical facelift. Absolutely. Yeah. Right. It's a suture lift is kind of the category, and these have come and gone over the years, and they're back now with a new absorbable suture, which is great because it's eliminated some of the problems of palpable sutures that were the permanent ones where you could feel. So yeah, it's kind of a neat new advancement. Yeah.
One of the other things that's been really exciting in your office has been the Coolsculpting, and that's getting rid of fat, freezing your fat.
Yeah. So on a personal note, this has been a great new technology, and I remember when I was first introduced to Coolsculpting, and I was kind of not really sure about it, and was talking to a colleague, and he said, this is really great, you really need to look at it, and it's pretty amazing. And then as I delved into it, I was more impressed. It's easy to sort of write it off because you're sort of like, well, what does it do? It's freezing. What does that, just shrink an area for a little bit? But the reality is, once you look at the science, it's very powerful. It's actually permanent reduction of fat. It's like liposuction, but without surgery. I mean, it really does eliminate fat cells from the body. And so I just think it's a phenomenal technology that's going to really grow in popularity because, let's face it, who doesn't have a little fat they want to get rid of?
Yeah, right.
When I know a colleague that has a counterform that says, do you have any fat you'd like to get rid of? And then it has like yes, a box for yes, and there's not even a box for no, because, of course, everybody says, right. Oh, yeah, I've got a little bit here or there. Even patients I see who are really skinny say, oh, no, I have fat, I have a little bit here or there. So we all have, these tiny little problem areas, and that's really what Coolsculpting is great for, is to reduce these little problem areas, whether that's your abdomen or the flanks or the bra fat or back fat or under your chin, the double chin. These are all areas we can treat with Coolsculpting, which, and get a permanent reduction of fat. It's really phenomenal.
So how does this work? I mean, you have these, from what I've seen, it looks like a vacuum pack. It's like something like a big vacuum, big suction that sucks your skin and your fat into it and freezes it.
So the advances that they've made in the technology, and it's gotten a lot better even in the few years that it's been available, and obviously this is FDA approved and, scientifically proven and all. But the advances have become the better ability to freeze tissue with less suction and less disruption of it, which is good. So the technology has gotten faster, more efficient, and less discomfort as a result of improvement in what you're calling the applicators, which are basically the devices that fit onto different areas of your body. So they make a lot of different shapes and sizes that can fit certain areas, and obviously we're all built differently, so you can mix and match to see where it works. But basically these are kind of shallow cups that suck the fat into the device and will freeze it for 35 minutes. Now the new run is only 35 minutes.
Nice.
And then that comes off and it's just massaged out, and you have a little bit of redness and swelling in the area, at first, and that little redness and swelling may take about a week to go away, just sort of gradually, and then it's flat, or it's back to where it was, and then gradually over the next month you'll notice that area just flatten out. It's really quite remarkable. You just see this natural recontouring, and so it's completely non-invasive. There's no surgery, there's no injections, there's no suturing or anything like that, and you get this gradual nice remodeling of the area. And then once, after a month, you see a month to 2 months, you'll see the result in that area. And then you can come back, and if you want to treat more, you can treat more. Or very often people will treat the adjacent area because it, sometimes it works too well. It shrinks the fat so well that now that looks flatter and the next area looks
kind of bulging
a little more,
out.
Yeah. So you just to blend in. And so there's a strategy with that as you treat, multiple little treatments to blend into an area to give the best result.
Is there such a thing of doing too much of this? I mean, can we really get rid of all of the the fat and then have a problem, or is that even possible?
Well, I don't know. We've had patients who've come in for 30 treatments. Because it's if it works well, again, like all these non-invasive devices, it's not 100% response, but it's greater than 90%. Almost everybody has really good responses to this, and so people who have good response are like, that worked great, I'll try it again.
Okay.
And even like, for example, I treated, when we first got the technology, my lower abdomen and flanks, and that worked nicely. Didn't really think about it for a while. I just got a nice result. Several years later, we got sort of the newer Cool Advantage, the upgraded technology, which is, like I said, fantastic. So I decided to retreat the lower abdomen to get a little more flattening. And then because the flanks, I had done the anterior flank, but I noticed kind of in the mirror, the posterior flank, like the back part, was more full than the anterior part where I had treated. So I had him do the posterior flank, and that worked really well. And like I said, it was minimal discomfort because the suction isn't as much, faster. It only took 35 minutes. And the results showed up even quicker. Within a few weeks, I could see it flattening, and within a month, significant difference. So it's really pretty remarkable technology just to kind of reduce these problem areas and flatten them out. It's really... Can
we do a show hooked up to the machine?
We could.
Because I really need to experience this to really understand it,
Yes, you do. just to experience a little bit.
Yeah.
But it's fun because you're there on this machine, and like I said, in my office, I don't sit still much, so that's
right.
like for the time I'm there, they're like giving me bills and paperwork and checks to sign, that kind of thing. But it's, I think people don't realize how well this works, how great it is. And for people who are fit and work out and are, taking the time to eat right, exercise, and do all the right things, but they still, as we age, our body changes. Mm-hmm. We start to accumulate a little more fat in the abdomen or flanks, or you might have these other areas like the back fat or bra fat or inner thighs, or even outer thighs. They have panels that don't use suction, that just cool on the outer thighs. They can shrink that down. The areas under the chin you can treat with a newer, it's called the Cool Mini, and it just shrinks the fat under the chin. That's a really nice treatment, and we've seen really good results with that, just flattening, taking away the double chin. So it's pretty remarkable when you start using this technology on these different areas to see what a remarkable difference you can make. And again, with no downtime, and activity-wise, you don't really have to alter your routine at all. I mean, you can go work out and do all the normal things you typically do. So it's
right.
really a no downtime procedure, which is great.
So somebody who's working out and dieting right now, and they're like, okay, well, I'm not really where I want to be yet. Do I go ahead and get this treatment now, or do I wait until I want to be where I am? Is there a theory when it comes to this?
Yeah, I know. I think doing it, if you're trying to lose weight, doing it with losing weight is helpful. Mm-hmm. This isn't a weight loss treatment.
Right.
You're not going to lose significant amounts of weight. It's a body contouring treatment, but I find that it gives you a nice boost, because when you're trying to lose weight, part of it may be just overall, okay, I'm too heavy for my height, and I need to lose some pounds for my overall health. But part of it is definitely what you see in the mirror, like I'd like to be a little trimmer, right? So with this, you can treat those most visible external areas, like I said, for me, kind of lower abdomen and flanks, and I work out a lot, so it's I've never really been overweight, but there was just a little more fullness than I liked. It wasn't there when I was 18.
Yeah.
And now so you want to kind of just try to look your best, and I do work out a lot and do lots of running, biking, swimming, sit-ups, weightlifting, and all that, and stay very toned. But nonetheless, there was still a little more fullness in the lower abdomen than it used to be, and maybe a little bit more in the love handles, and that's now gone. It's back to where I was at 30. It's great, and so for that, I think it gives you a boost and an encouragement, because as you know, when you lose weight, it doesn't always go where you want it to go. It goes where it wants.
Yeah. Exactly.
Yeah, so you can work really hard, and still the one problem area may not change much. Yeah, even when the scale does. So I think it's good because it encourages you, and it can be very specific to the area you want to lose. So one of the things that is important that when you do this is to we always weigh patients before the treatment, because you want to at least stay the same or be losing. You don't want to gain weight. And so sometimes, people will have CoolSculpting to shrink, down the abdomen or flanks or whatever, but then thinking, okay, I'm getting this technology to shrink the fat, so therefore I can eat whatever I want. And then they eat more and gain weight. And then they say, well, it didn't work. And it's like, well, you're 10 pounds heavier. And so, obviously the way that works is you can eliminate some fat cells, but if you gain weight by eating too much, then the remaining fat cells will expand.
Yeah, they'll take up that room,
They'll take up that room, right? So you won't see in order to really see the result, you have to keep your weight at least the same. You can't be gaining weight while you're doing it. But if you're losing weight while you're doing it, you'll see an accelerated rate and you'll see even better improvement. So that's very encouraging, and that's why that's a good combination to be doing it while you're losing weight.
Definitely. It helps you, like you said, encourages you when they put that piece of pie in front of you at dinner, like, nope. I really want it, but I'm just going to push it away and just, suck it up a little bit. So we can get the CoolSculpting. You mentioned a couple of places. Let's go over it briefly again. We've got the outer thighs and the inner thighs as far as the legs. Yeah. Then we've got the abdominal region, the lower and the upper abdominal regions.
Right. Back fat. If you have mid back, you get sometimes extra rolls there, or lower back. Bra fat. Up kind of at the crux of the arm. With men, gynecomastia or large breasts can occur with hormone changes, so we can shrink breasts in males. That's pretty popular.
Great. I didn't.
And even knees, the inner knees, you can get a little fat pad there. So with some of the new devices that are much smaller, you can treat small little areas.
Now you're making me look at my knees. Now I've got one more thing to be.
Really over. Now there's so many different ways to kind of treat it. So many different sizes and shapes that almost any fat you can pinch, you can treat.
Okay.
So that's nice.
All right. Let's take a quick break here, and when we come back, let's concentrate a little bit on the chin and the Cool Mini and the other things that you can do when your face looks a little bigger.
And even the jowls. You can treat the jowls.
Okay, cool.
Yeah.
All right, you're listening to Look and Feel Your Best with Dr. Patrick Flaherty. We'll be right back. Welcome back to Look and Feel Your Best with Dr. Patrick Flaherty. I'm Gina Birch. We're giving you some updates this morning on some of the hottest technology that Dr. Flaherty does here at the Azul Cosmetic Surgeries and Medical Spas. By the way, their offices in Fort Myers, Naples, and Bonita Springs.
Right.
And you do all of these procedures that we've been talking about in all three locations?
Well, yes, we do. Right now we like to pair the CoolSculpting machines because that allows you to do more areas in a shorter period of time. So we have two of them in Bonita and two of them in Fort Myers, and most of our Naples patients, if they need the CoolSculpting, will go up to the Bonita, which is right at Coconut Point. It's right there on 41.
Get a little shopping done while you're doing that.
Yeah,
or
that's
afterwards.
A fun combination.
Love it. So we were talking about CoolSculpting and how it freezes the fat and it just kind of eliminates and disappears and goes away. And we were talking about the different areas. One of the things that I think people forget about often because we're obsessed with our abdominals and our thighs and our arms and all these things, but it's the chin too. I mean, people can be thin, but just carry this weird pocket of fat under their chin, and it makes them in photos look like they're 20 or 30 pounds heavier.
Right, and we've seen great results with the Cool Mini. So they developed a special device just to freeze the fat under the chin, and that works really well. A lot of times people will have two treatments, but you can see meaningful results with the first one, and we just do the second one to get further improvement. And so that's really nice. And that, these smaller new devices for under the chin and other small areas like the inside of the knees and some of these other little problem areas. You can also treat areas like the jowl, which is interesting because some patients have a really full face and are bothered because the jowl, not just from looseness of the jowl, but just from fullness of the jowl. Mm-hmm. It's just a little bit too full that gives them a little bit of heaviness of the lower face. And so this is an area we've been very selectively treating and seeing nice results with just shrinking down that fat, which can give you, kind of improve the shape of the face. We want a heart-shaped face that accentuates the cheekbones and kind of tapers as you come down to the chin. You don't want it to be really heavy in the jowl area. So it's nice that, we have this new device that we may be able to just sculpt the jawline a little better without surgery, which is, very exciting.
Now, this treatment for the jaw is completely off subject of what we're talking about here, but it just reminded me of something that when the Botox sometimes works, but that's a whole other issue. It's not not your fat. But if you look at your face and you think, wow, it looks really full, is it fat, or could Botox work in there too?
Yeah. So if you look at a face, some faces that are kind of heavier in the lower part of the face that just look kind of wide, that can be in the anterior part, jowls, which is fat, sort of the jowl fat pad in that area, or posterior when you go back toward the ear. There's a big muscle it's a muscle of mastication, a chewing muscle called the masseter muscle. And if you bite down real hard with your teeth, like kind of grind your teeth together, you'll feel that muscle. If you put your finger over the cheek, that deep muscle, when you flex it, it makes a bulge. And some people have really enlarged muscles just genetically, or it can be from TMJ and grinding and that kind of thing. But putting Botox into that muscle, you can put it at, relax the muscle and it'll shrink it down. So it's a great way to taper the back part of the face. And so, and a lot of Asian women will have faces with large masseters that give them, instead of that high cheekbone and lower taper, it's sort of too full on the lower part of the face. And so we use a lot of Botox to shrink the masseter, to taper and give a better shape to the face. And the same thing, this may help us shrink some of that fat that can make the anterior part of that face a little bit too full. And so we're now, developing these really nice, creative, non-surgical ways to reshape the face, which is really a big part of what rejuvenation of the face is trying to create a youthful shape. Whether it's adding or subtracting, it's trying to create more a youthful and attractive shape to the face.
Right.
Yeah.
What about Kybella? What is that, and how can that be used in the areas that we're discussing now?
Yeah. So Kybella is another new product. It's an injectable. It's deoxycholic acid, which is an acid that actually dissolves fat. And so that is an FDA-approved injectable that shrinks fat. And they initially approved it for fat under the chin, which, obviously is a common area. And it works very nicely as well. So you do, a bunch of tiny little injections. It spreads into the fat. It'll gradually dissolve the fat, and it sort of disappears. With Kybella, you'll have more swelling than you typically get with the Cool Mini. Just because it creates a lot of inflammation. And there'll be a lot of swelling, that most of which fades in the first week. And then gradually you see the fat just disappear. You get similar after that first week. It kind of just gradually flattens out. And then after a month, you can do a second treatment if need be. But it's a nice treatment. I prefer the Cool Mini if it can be done, but not everybody's face is shaped properly for the Cool Mini. So Kybella is a little more adjustable to the individual anatomy of the face. So we have used both techniques with really good success, and it really just comes down to if they can fit on the Cool Mini, if that seems to fit their shape of their neck, that's our preferred way to start. If not, we use Kybella.
Okay.
And Kybella may be used, in other areas of the body as well to shrink unwanted fat. So that, the future of that, it remains to be seen as, more studies are done to see how effective it is at shrinking fat in other areas.
Oh, good. I'm glad you brought that distinction up, because I was trying to figure out, well, which would I choose? What is better? What has the best results? And why would I pick one over the other? And, I guess if the instrument of Cool Mini or it's Coolsculpting wouldn't fit, then that's the deciding factor.
Yeah, Kybella can cause a fair amount of swelling, so that's a little bit of a negative for those few days that you have that swelling. After that, once the swelling goes down, then they're kind of on par. You sort of see the fat just gradually disappear. But with Cool Mini, you can have it done in really no downtime. You can get a little bit of redness and swelling with the Coolsculpting, but it's fairly minor and it fades pretty quick. So that's the main difference that I see. They both can be very effective, and I think they both work well. So that's kind of how we look at it.
And they both take, you said the main difference is the swelling with the Kybella because of the injections. But is there any other difference? As it wears on time, or are they pretty on par? Yeah,
they seem to be pretty on par. Like I said, I don't, the skin. So, a little bit more swelling, a little bit more discomfort with the Kybella. I think obviously obviously, if you swell a lot, it may make it more uncomfortable. And I think that means that, you know, the deoxycholic acid is creating a little more inflammation. So, you know, probably a little more soreness, more swelling. And that could be, you know, anywhere from 3 days to a week. So there's a little bit of, you know, visibility of it, where with the Cool Mini, you will have a little redness and swelling for a couple of days, but it tends to be very minor. You don't get that same degree of swelling. So that's the main difference. But after that, you know, we've used both products on a number of patients and seen very good results. So originally I was like, well, Cool Mini's better, let's just use that. But then some patients, it hasn't worked out because you have a hard time freezing that particular spot. And so there is some limitations in terms of getting access to the area you want to treat in certain patients, just based on the way they're shaped and their anatomy. So, you know, in those patients, we've used the Kybella and gotten really good results, and that's kind of encouraged me to, you know, to recognize that this is a really good treatment as well, and one that's going to be helpful.
So I've got a special event coming up, and I've got the perfect outfit, whether it's a suit or the dress. But I know that in photographs, that double chin or that heavy jowl or the neck is going to make me look a little heavier than I want to look, and not photograph as well. So I've got this special event. How long of a stretch or how much time should I give it if I want to get one of these treatments done to have it really set in and look nice? I mean, what am I looking at? Because I can't go out and do it this week if it's the next week. Right.
Yeah, you want a month. You know, you see pretty good results at a month. You may see better results at 2 months. And obviously, you know, both of these technologies, Kybella and Cool Mini, can be repeated and often are to get further improvement. So, you know, really, you know, if you could look at it from a 2-month standpoint. You know, you do a treatment, you wait a month, see what you get. You can do a second treatment if you feel you need it, and then get the remaining amount. So 2 months in advance of, you know, a big event, and, you know, would be ideal, or sort of minimum. You know, obviously you could do it 3 months and give yourself a little more margin there too. Right. But generally, you know, the swelling and that kind of thing fades pretty quickly, you know, within a week. And so, but the results you won't see immediately, and that's the thing. You have to wait. You probably see the peak result from a single treatment at 2 months with both technologies. So,
okay. Do you have any before and after photos of this one on your website?
That's a good question. We should, because we've got some great post-ops.
I know you're always changing it, so
but
yeah. Sorry to put you on the spot.
Since I don't actually make the changes myself.
Well, I brought that up because I always think of, you know, websites as being such great tools, and I know that yours has a lot of before and after shots of a lot of different things that you do, and seeing is believing, you know, and we talk about it, and people hear us talk about these things every week, you know, for an hour long, or however long we're in here. And if you really want to see the results of some of the things that we've talked about, go to azulbeauty.com. That's AZUL, azulbeauty.com. And it's really impressive when you see these before and after. And they're not doctored. It is right out of the camera. This is in all of its glory, you know, the people who agreed to do that. And you also have a lot of information on there about seminars, about introductory offers. So it's really a good resource for people.
It is. And, you know, anybody that listens to the show, if they are interested in a consultation, you know, with me or any of our staff, you know, we waive the fee if they're listening to the radio show and mention that. And that's a really good way to get information, because with that, we look at the entire face, or whatever their concern would be, talk about options, and then can give them more specifics. And, you know, we have plenty of patients who, you know, have had good results with all these types of procedures, who are willing to talk to patients too. So that's, you know, they can see patients. And of course, our staff is, you know, kind of a walking billboard.
No kidding,
know,
right?
Pretty much everything we do, you know, staff members had, or many of the staff. Coolsculpting, almost everybody on the staff has had. Botox, almost everybody has. Fillers and that kind of thing. But no, that's helpful, because seeing patients and seeing what they look like and what they've had done can be a really reassuring, because there's a big fear of the unknown.
Sure.
And, you know, people naturally assume if they have something like a filler or something, they're going to be, you know, everybody will know, and it'll be very obvious, and they'll look different. And that's just not the case. So, you know, the consultation and meeting the staff, and, you know, meeting some of our other, you know, patients is a really good way to get information about these procedures.
Okay. AzulBeauty.com. Their office is in Fort Myers, Naples, Bonita Springs. And if you want the phone numbers you can call for a consultation. It's 239-415-7576. That's 415-7576. Dr. Patrick Flaherty will not be answering the phone call, but he will be in the office. You're listening to Look and Feel Your Best. Dr. Flaherty will be back next week.
Sounds great, Gina.
All right, I'm Gina Birch. We'll see you next week.